The following podcast is by Dr. Shawn Weiss, President of Senior Health and Wellness Group on the Answers for Elders Radio Network. And welcome back, everyone, to Answers for Elders Radio. As we are here with Dr. Shawn Weiss, and she is talking about all different types of topics about senior health and wellness. And we talked a lot about summer safety, and then we moved into, the whole world of caregivers. And if you're not taking care of yourself, but I think this third segment is so important because we're really going to dive into mobility and falls. And I think, this is something, Shawn, that I think about. I talk to families all the time that say, oh, I'm just going to move mom and dad into my house. And I think that's great to a certain degree, but there's this little red flag that goes off in the back of my mind going, this light, flashing red light that goes, what's your house like? Yes. What are the things in your environment? Is there somebody, how safe are they? What's the bathroom like? Which is a huge piece of it. And so I am so glad you're going to take on this topic. So I guess the thing that I'm saying is that I can only imagine since the pandemic that this is a bigger issue more than ever because we've been so sedentary for so long. Is that right?
Absolutely correct. And what we're seeing, it was already considered a national, almost epidemic proportions. But now with COVID-19 and the isolation, the stay-at-home orders, the lockdowns, people couldn't access medical care, and just the activity and the behavior of kind of being more sedentary has all kinds of increases in weakness, decreased balance. So you've seen a significant rise in falls and falls-related hospitalizations over the last year and a half with those over 65. And it's really important. One thing that we do stress is that, falls is not a normal part of aging. And that's one of the first things we hear. We're like, I'm 75. I'm just going to fall. Wow. Yeah. And also we deal with the fact that the silent, we say the silent falls because, they say over half of falls are not reported. Simply because of fear. They don't want to let their son know or their daughter know or their granddaughter know or mom, because they don't want to have to move out of their home. No. So couple that with the pandemic, and we really have a problem on our hands right now. And it's kind of a national movement. For instance, in a couple of weeks, I'm speaking an Ohio Falls Coalition. We're doing a big virtual seminar that's free to the public on a whole day's worth of falls and falls prevention and wellness topics. So it's incredibly important right now that we are checking on our seniors and starting to promote activity increases, even if it has to be in their own home. And there's many things that we can do. And, as an agency, home health agency owner for 18 years, one of the first things we look at when we go into a home is the environment. Sure. And we want to assess the environment, utilize your home care services, especially like you said, maybe grandma's had to move in over the last year and a half, or maybe mom or dad has had to move in. Well, that's a whole new environment. And that's a transition period in and of itself. And you see
and it's
the
a big
checklist of
for
things.
The family.
Oh, huge commitment. You have to really do a good environmental check. That's one of the number one things we recommend is having somebody to do that. And there's a lot of, like I said, your area aging office will send people out to do that. Home health agencies also will send therapists out to assess your home. And there's many things you need to look for, not just rugs and cords, but the bathroom. That's where most falls happen in the home, and most falls in the home happen in the bathroom. So checking for safety. Do we need grab bars? We need to pull up all the rugs. Do we need to change the seating situation? Do we need to move things in the kitchen to a better height so that we're not bending and stooping or reaching on our tippy toes to get things in and out of the cupboards? There's many, many things that we're looking at. Vision, footwear.
Well, and if we get a lot of, well, we're just going to move mom or dad in. And it's like one of the things that I warn people of. It's like if by doing that, it's a huge commitment, but it's also could mean a major transformation of your home, because You have to realize your bathroom may not accommodate a wheelchair
Exactly right. Or a walker.
or a walker.
Hmm.
You may have a floor that's slippery, or a bathtub that they have to crawl in and out of, which is a
Hmm.
huge, a bathroom is, pretty much a no-brainer that you're going to have to redo that. So there's a lot of different factors that people have to think about when they're moving a loved one in with them. And it's not that you don't want them there. You could come get them once a week, but sometimes they're better in an environment, if their own home is not supporting them anymore, to
Hmm.
to move into, maybe it's not a full assisted living situation, but it might
Hmm.
be a wonderful adult family home that's kind of
Right.
a bridge, which is a smaller environment. There's different types of options that for a loved one, and every senior is different. it's
Right.
it's absolutely as unique as anything. Nobody's trying to pigeonhole anybody,
Right.
and that's the thing I think that's so important
And I think
about
the
this.
number one reason is that you want increased supervision. And
Yeah.
depending on, if your loved one has any type of dementia diagnosis, or especially if they've had a decline in their cognition during the pandemic, you want, your number one thing is safety. And
Hmm.
maybe you've chosen to move mom and dad in, which is, maybe the right thing to do. So you have increased supervision
Hmm.
for those who are living alone, or an assisted living where you have more opportunities and more sets of eyes. But if you are in your own home, or maybe mom and dad are living alone, utilize home health
Right.
as a way to have professionals come in, assess their strength, assess their balance, provide you with guidance on the environment and how to set it up appropriately, tell you which type of adaptive equipment needs you need to be addressing, whether that's a shower bench or a tub bench or an elevated toilet seat, or hey, we're taking out the rugs. And I tell you, that's one of the hardest things. If you want to pick a topic that we see in home health with our, especially our women over 65 years of age, and the rug matches the shower curtain that matches the towels, and I'm just not going to roll that up, regardless
Yeah, my
of,
mother had a
because it looks
doily over
too
her
nice.
toilet. I'm
Yes.
going like, Mom.
And I know everybody listening knows exactly what I'm talking about. And I'm like, well, how
Absolutely.
about we just roll it up right before you take a bath or a shower, and then we can have everything match. Those are the
Yeah.
types of things we look at with falls. Another, not just the environment, but other important things. And this is the therapist coming out of me, and I could just go on and talk about 2 hours on this topic. But we want to see, have you started getting your vision checked again, since we're able to get out to the physician, or maybe you're doing telehealth visits still. That is huge. Vision plays a huge role in fall risk. And do you
Yeah.
need a new prescription? Are we looking at footwear? Does
Yeah.
mom or dad, do they have edema? Do they need a change in footwear? Maybe maybe they had shoes, they had edema, now the edema is gone and the shoes are slipping and they're too big.
Right.
Um, do we need to make sure grandma's not wearing her 2-inch platforms, to go out to church when there's not a need for that? And these things are not as easy to change as you
Mhm.
might think. So there's a lot of resistance to some of these changes, but the
Absolutely.
most important thing is we want to prevent a fall, and we want to prevent a hip fracture, and we most importantly want to prevent having to go to the hospital.
Well, and I think that's the other reason why you bring in a professional, because mom or dad are going to be resistant if you're the daughter or the son, and you need to stay the daughter and the son. You don't need to step
Absolutely.
into this control thing. But bringing in, someone from the outside, such as a home health, which Medicare pays for it, to do an assessment of the home. I think
Mhm.
one of the things that's really important about that is that professional can help guide your senior loved one in a really good way, where you don't have to be in the middle of the fray. And I know for me, I learned that, really, really carefully. My mom had dementia, which was really, she would talk in circles sometimes. But the thing that was really important was I learned, never correct her. Don't try to, change anything. Let the professionals do their job. And I,
Right.
I think that's really an important piece of all of this. Don't you agree?
I agree. And the education piece is huge. Sometimes as, a home health therapist, my biggest, contribution was not just getting, my patient to do the exercises, but educating all the other caregivers for when I'm not there.
Sure.
Even home health coming in 3 days a week, but what's happening the rest of the time? Our job is
Mhm.
to set our patients up for success. and the families up for success. So setting a simple home program that can be supervised for the days that I'm not there. Those types of things are so easy to do by having a professional come in, even if it's only for a few sessions, to take a look and give you peace of mind. And again, those little things help unnecessary trips to the doctor. They help, prevent hospitalizations, and nobody wants to have to go to the hospital right now, for risk of exposure. So
obviously,
yes, it's important that we want you to age in place, and we want you to stay safe in place.
And a couple just things I'm going to throw out there before we close at this hours is lighting is huge.
Absolutely.
How often do mom or dad get up in the middle of the night to go to the bathroom and they don't have proper lighting to get them into the bathroom? That is a big factor. And I know that there's smart technologies out there as well that we've talked and covered, that, there are different types of mats and things like that can help, an alert system, which I think that we can talk about. And then third, let's talk, Shawn, I'd love to, in another segment, just talk about outdoor safety, because there's all kinds of seniors right now that have gardens that they've nurtured for decades or things like that in their home. So we'd love to cover those things as well in another topic someday, and we certainly will do that. But in the meantime, we're really excited. I guess right now we're going to come back to the next segment, and we're going to just zero in a little bit more about the Delta variant, what's happening, because I think this is really important. And Shawn, we'll be right back after this. We would like to thank you for listening to this podcast by Dr. Shawn Weiss, CEO of Senior Health and Wellness Group, focusing on wellness and prevention strategies for seniors. As a fall prevention specialist, Dr. Weiss provides family support and education to keep your loved ones safe. You can learn more by visiting her website at www.seniorhealthandwellness.org.